Hey guys, if you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First off, it's free. Secondly, there's creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcast, and so many more. You can make money from your podcast with no minimal listenership. It's everything you need in a podcast in one place. I absolutely love it. So make sure you download the free Anchor app or go to Anchor, ANCHOR.FM to get started. Hey guys, welcome back to Baby Bump Life's podcast. It's Nurse Wit here again, and we are on episode 7 of our first season. I want to talk to you guys all about inductions and if you have to have an induction, what you can expect. And maybe I'll give you a little bit of information so that you'll have some questions to ask your doctor or nurse midwife if they are kind of talking to you about possibly doing an induction. So, it's ultimately up to your doctor as to if and when you are going to be induced. Now, for an elective induction, saying you're just done, you want it to just be over with, you're ready to just have your baby, they cannot do that before 39 weeks. So 39 weeks, it has to be if it's an elective reason. Now, if it's a medical reason, and the high-risk doctors are recommending that you are delivered because of some sort of medical reason for mom, then that's a totally different story. And again, that's up to the doctors. I would say probably some of the most common reasons to be induced would be, the first one is probably because you're past your due date. That's pretty common. And then maybe the baby's too big, the baby's LGA, large for gestational age. Sometimes the docs will recommend delivering a few weeks early, maybe 38 weeks or 37, something like that, just because it would be better for the baby to come out sooner than later and keep growing. Another one, if mom's maybe diabetic and blood sugars are uncontrolled, or maybe if mom's got high blood pressure and her blood pressures are kind of going a little too high. Those would be probably some of the most common reasons, but again, it's ultimately up to your doctor, and your doctor is the one who makes that decision. Once they do and they decide and talk with you about you being induced, they will call the hospital and set up a time for your induction. Most hospitals try and get you in, but sometimes, it's labor and delivery, sometimes it gets pretty busy, and the hospitals do have to call you and put you on hold. So don't be surprised if that does happen to you, because it's happened before where we have to call moms and say, I am so sorry, but we have, basically not enough nurses or not enough rooms or whatever the problem may be. And so just try to understand that if they tell you they need to put you on hold, just know that is something that can happen, because there are other moms that are, there at that time. So but what will happen once you get there, your nurse will have you sign consents, talk to you about your medical history, do the whole sign-in process at the hospital. And then your nurse will check your cervix and call your doctor or nurse midwife for orders. Sometimes your doctor or nurse midwife might check your cervix if you have like a doctor's appointment that morning. They might check your cervix and then call in before you get there with orders. But typically the nurses will check your cervix and then call the doctor. Now, the medications that they can give you, there's kind of a list, and I'm going to kind of say them in order for you. So they typically start off with medications that are prostaglandins, and those medications are made to soften the cervix. The medications are either Cervidil or Cytotec. Cervidil is medication on the end of a string, so kind of think of like a tampon, but a little smaller and flatter. That gets tucked behind the cervix or by the cervix, and just softens and thins out the cervix to prepare it for labor. That medication stays in for 12 hours. Some moms do go into labor with the Cervidil, some don't, some just feel cramping, so don't be surprised if it happens either way. It just depends on honestly how your body reacts to the medication. The other medication that is similar to Cervidil is Cytotec. That is in a pill form though. It's very small. The pill form is typically a fourth of a normal pill, and it's either given vaginally or orally. And that depends on how your doctor orders that medication. And Cytotec as well just will help to soften the cervix. And again, these two medications are given at the beginning. So these are kind of for the moms whose cervix are longer, thick, and the baby's still high. This is when the cervix is just starting, this is when we're trying to get it to dilate. So the other thing that can be used, which is not necessarily a medication, but is the Foley balloon. That can be placed, it's a balloon on the end of a string or a tube, and your doctor will place that in your cervix and fill it up with fluid, and then it will stay in for a certain amount of hours, and then they tape it onto your leg to kind of give it a little bit of tension. And then by the time that falls out, you're usually about at least 4 centimeters. Sometimes moms can be 5, but it'll just fall out of your cervix. It'll still be sitting in the vagina, but it'll fall out of the cervix. So that's nice. That's not a medication. So if you're not wanting to do meds for an induction, you could ask your doctor if that would be something you could do. Now, if your cervix is 0 station, not 0 station. If your cervix is 0 centimeters, then that's not possible. So it does have to be that your cervix has to be able to fit that little Foley balloon in there. So then after you do those things, the next medication that you're going to have, so whether you did the Foley balloon at the beginning or you did the Cervidil or the Cytotec, the next one that they can give you is Pitocin. Pitocin is a synthetic or a drug form of oxytocin. Oxytocin is a hormone in our body that gets stimulated or released when we do love things. And having a baby is a love thing. So sometimes when we're trying to get your body to release that, we will give your body just a little bit of that Pitocin until your body starts to release its own. We start it in very, very small amounts and increase it in small amounts until your body has kind of taken over. Every doctor is a little bit different on kind of how we manage this, and every hospital has a little bit different policies, but just know that this is something that your nurses have to titrate, and they have to watch the baby's heartbeat and your contractions to determine if they're able to go up on this medication or not. So Pitocin is the one that typically will get things rolling. Most moms who have been induced versus not being induced have said that Pitocin does make their contractions hurt and a little stronger, which is the point of labor. So, but with that being said, some moms choose to, let me get that epidural before we start the Pitocin, if, they have that option. And then one of the last things that they can do, which is more of a natural way of augmenting or furthering along your labor, is AROM, or artificial rupture of membranes. And in order to do this, your cervix has to be at a certain point, baby's head has to be at a certain point, and this is done by the physician, and the physician has to feel that it is comfortable to do at this point, because the problem could be if they broke the water and the baby's head is not down enough, then something could slip between the baby's head and the cervix, like the cord or the baby's hand or something. Nothing that we would want to have happen, because that would be an emergency C-section. So if you are planning on, I want my water to be broken, and the doctor tells you they can't, that is the reason why it is just for you and for baby's safety. So those are the different medications and ways to do an induction. And again, it's up to your doctor or nurse midwife on if they feel that you need to be induced, and what medications they feel is best for you along the way. So I hope that helps a little bit and gives you some ideas, and maybe it'll give you a couple questions if your doctor is kind of talking to you about an induction on what you're kind of thinking about. So as always, if you guys have any questions, please feel free. You can email me, you can message me on any of my social media, and make sure you subscribe to my YouTube channel as well. I do have some more videos on there that talk a little bit about inductions as well. So thank you so much, guys, for listening, and I will talk to you all very soon. Have a great day. Bye-bye.